All right. Welcome, everybody. We've just hit the 1 p.m. mark, so I guess we will kick off, Anne, if that's all right with you.
Great, thank you,
You're
Emily.
very welcome, everybody, to the webinar today. My name is Emily Donohoe, and my co-host here is Dr. Anne Donohoe. We are not related, it's just the same surname,
As far as we know.
as far as we know. We're absolutely delighted to see so many attending now. I can see that the numbers are creeping up there. So we are hoping that we can keep this within the hour and a half. It might run a little shorter, it might run over, but we for sure are aiming for our hour and a half mark because we understand everybody is quite busy today and taking time out of their busy working day to attend. So we do really appreciate that, don't we, Anne? And as we go along, I know maybe Anne will probably introduce our colleagues for each one of the presentations that are going to happen today. What we're going to have is a number of presentations on various different areas of programs here in the school, and we are inviting attendees to pop any of the questions that they may have through the Q&A function. So you'll see the Q&A function along the kind of manual bar there, whether that's it should be at the bottom of your screen on your Zoom webinar interface. And our colleagues in the background, we have Nicola Berry, Marta Konezik and Sean Kenny, who will be able to answer those questions in the background. So please do keep in touch with us over the course of this webinar, and we will answer questions as we go. So without further ado, I'm going to hand over to Dr. Anne Donohoe, and we hope you have an enjoyable session today.
Thank you, Emily, for that introduction. And you're all very welcome to our webinar today. We're delighted to have so many people attending. And I'll just share with you the presentations that we're going to have. I'm going to do a brief presentation starting off on looking at UCD and the school, and then focusing in on the particular thought graduate programs that we have on offer here, the full suite of programs. And then we're going to have a presentation on the midwifery programs by Associate Professor Denise O'Brien. That will be followed by a presentation on health systems programs by Dr. Bryn Gilmore. Then we will have an overview of the MSc in Advanced Practice Nursing by Associate Professor Mary Ryder. And then we will have a presentation on MSc by Research and PhD programs. And now that's a recorded presentation which we will share with you, and that's by Professor Karina Nocton. And then last but not least, we have an overview of the application process, which is a really important piece and something that I think our audience are very, very interested in. And that will be delivered by Sean Kenny, our Program Office Manager. So that's what's on the menu, and I hope you enjoy the next hour or so with us. So I'm just going to share my screen now in terms of the first presentation. So you can let me know when you can see my screen. It's just coming up there now. As I say, I have two presentations. The first one is really an introduction to UCD itself and the school. And then, as I say, I'll focus in on the particular full suite of programs that we have on offer for you here in UCD. So I'm just going to switch to presentation mode. It's a little bit slow today for some reason. Okay. Sorry. Now, can you all see my screen? It's visible? Okay, thank you very much. Okay. So as you all know, UCD was founded on the 3rd of November, 1854, which makes it 171 years old this year. On day one, when it started, there were 17 students registered to the university from 2 countries. Now we have 38,000 students from 152 countries. So when you join UCD, you're joining a very modern, large university system. We have 6 colleges, 37 associated schools, and multiple research institutions and centres. And it's a very high-ranking, research-intensive global university. In terms of the campus itself, it's very modern, it's very progressive. We fully embrace the notion of equality, we fully embrace the notion of diversity, we fully embrace the notion of inclusion. So there's something on the campus for everybody. We always encourage our thought graduate students to engage with the campus facilities, be that the sports facilities, swimming, etc., all of the societies. Our undergraduate students are very good at linking in with the various services on campus, but we do encourage our third graduate students to access those services. And it really is a university for all, and we're very proud of that. It's a lovely place to study, it's a lovely place to work, and it's a lovely environment to be in. So I would urge you to use our services when you join us here in UCD. In terms of the school itself, it's the largest and indeed the oldest school of nursing, midwifery and midwifery in the country. So it has a great history going back many years, and when you join us, we'll tell you all about that. We also have the largest third graduate offering in the country. So there's something for everybody in terms of the third graduate process. There is a diploma, professional certificate, master's. There's a program there for you, for all interests, and we cover a wide gamut of programs, and I'll share that with you now in a moment. We have state-of-the-art teaching and learning facilities. It's a teaching intensive school, but it's also a research intensive school, and that's very, very important. And our teaching is always underpinned by the latest research. And we're very proud of the fact that we're in the top 50 in the QS World University Rankings for 2025. And that's a great achievement for us. And we're moving steadily up in the rankings year on year. So in terms of the programs that we offer, this is probably the most important page that I will share with you today. This is the landing page for the third graduate programs. And if you can navigate towards this, use any browser, just log on to the third graduate programs at UCD School of Nursing, Midwifery and Health Systems, and it'll bring you into this page here. And we offer programs across 15 diverse areas, and these include acute and critical care nursing, advanced practice nursing, cancer nursing, children's nursing, chronic care, CPD, gerontological nursing, health professions education, leading innovation and managing, mental health, midwifery, palliative care, prescribing medicinal products, public health and community nursing, and radiology and imaging nursing. So as you can see, there's something there for everybody. We couldn't obviously get a speaker. It would take a very long webinar to cover all of these. So I'm just giving you an overview, and you can navigate to your particular area of interest. So once you decide what you'd like to explore, like to hear a little bit more about, just click on any of those areas and it'll bring you into a page like this. I'm sharing gerontological nursing with you as an example. So you'll meet a series of drop-down menus. So we have, for example, master's and graduate diplomas on offer for gerontological nursing. So when you click on that, a drop-down menu will appear. And for each course, you can get information on what you will learn. You'll get all of the modules, their titles and their codes, and information on each module. You'll get information on fees, funding and scholarship. You'll get information on entry requirements and who should apply. So I really would advise you to do a little bit of homework. You may be coming to this webinar thinking, you know, I'm interested in a particular area, but look at all the areas, look at the 15 different areas and see what one best suits you. And as I say, there's a lot of information on the web pages. We share a lot of information. And so navigate to your chosen area and do a little bit of homework, a little bit of research before you link in with us. That's always very helpful. As I said, there are the 15 different areas, but also at the bottom of that page, there's a frequently asked question, an FAQ section. And again, some really important information is contained there. Information on funding is there as well, and a variety of student supports. We have wonderful student supports here in the UCD School of Nursing, Midwifery and Health Systems. There's a lot of advantages to studying with us here in the school. And one of the primary advantages is that we have world-class clinical partners. And you can see there, St. Vincent's Hospital, National Maternity Hospital, Harold's Cross and Black Rock Hospice Care, the Mater Hospital, St. John of God Hospital, Children's Health Ireland at Crumlin and at Temple Street, the Mater Academy, and obviously our health services for public health and community nursing placements. So we have links all across the country. And it's really, really important for any program that you're doing that you have strong clinical links. Because the clinical part of your program is equally as important as the theoretical part. So as I say, a key advantage of studying with us here in UCD is the quality of our clinical partners who are world class. Another key strength of studying with us here in the UCD School of Nursing, Midwifery and Health Systems is for each thought graduate program, we have a named program director. And they are experts in their area, they're conducting research in their area, they have expertise in teaching in that particular area, and we're very, very fortunate with the caliber and the quality of our program directors, some of whom you'll hear from later on today. That's really, really important. Our class sizes are very, very manageable. You get a lot of support, in some cases one-to-one support, and that's really, really important because you're in the thought graduate space, you're studying some fairly advanced theoretical principles, clinical principles as well, so you need that support. Equally as important, we have a named program director or program administrator for each program. And again, we're very, very fortunate with the caliber of our professional administrative staff here in the UCD School of Nursing, Midwifery and Health Systems. They can help and assist you with every element of the application process and so on and so forth, and the administrative process in terms of your program. And we work very, very closely with our professional administrative staff, and they're a key part of our school here. Other supports that we have here, other advantages of studying with us here in UCD is obviously the UCD academic and student support systems, which are really second to none. We have a writing centre, library facilities, etc., etc. So when you join a university of this size and of this calibre, all of those supports come with it. Because sometimes people are joining, particularly the third graduate space, that you may not have studied in a while, and you may have concerns about your academic writing, using library, writing skills, etc., etc., etc. So we can help and support you with all of that, and those facilities are here on campus in UCD. So if you want to hear a little bit more, obviously, there's the link, that's the link to the website, and also to the thought graduate programs page that I showed you earlier. But this is probably the most important page for you today. That's your landing page. Navigate to that. As I say, keep an open mind, keep a broad mind. Look at all of the 15 areas and see which one you're particularly interested in. Do a little bit of homework, read up on the structure, the modules, application process, etc., etc., etc. And remember, we're here to help and here to support you. And I always conclude with this particular slide. On the left-hand side is a photograph of some of our graduates from last year, from June of last year. And there they are with their mortarboards aloft. And they were probably attending the webinar that you're attending the previous year. So if you register with us and get working, you can be just like these graduates here at the graduation ceremony. It's a lovely photograph. Everybody delighted to have achieved their award. So I'll bring my session now to a close. I understand that there's a chat function, and if you have any questions, just ask the question on the chat, and some of our admin team will respond. So thank you very much for listening, and I'll now hand you over to our second speaker, who is Associate Professor Denise O'Brien, who will talk about our midwifery programs. I'll stop sharing my screen.
Thanks very much, Anne. Please. I'm going to start to share. That's a fantastic amount of information. So can everyone see that okay?
Yes, we can see clearly, Denise. Thank you.
Perfect. So let's start the slideshow. So I'm absolutely delighted to meet those that are online. My name is Denise. I'm just going to get this onto presenter mode for you, and I'll tell you a little bit about us in the background. So I'm a member of the midwifery team, and I know it's easy to say this, but we are the best midwifery team. And the reason I say that, we were a little bit later. UCD started a while back. But midwifery in UCD started in 2006, so we had a lot to catch up. And I would describe the midwifery team in UCD as very dynamic, very forward-thinking, very open. And that's really important because we're open to what the profession needs. So I'd say I'm one of the team, and I'm also a program director for one of the graduate programs. So for the next few minutes, I just want to tell you a little bit about our programs. So graduate midwifery. What is graduate midwifery? Because I'm not aware of your background. I was trying to figure out if we have anyone interested in midwifery, just to see, do we have nurses who want to be midwives? So I'm going to cover that because somebody might be interested in the higher diploma. or it could be that there's some midwives here that want to do some of our graduate programs. So I suppose the first thing to say, graduate midwifery is for midwives, but also today I'd say I'll cover for nurses that might want to do one of our midwifery programs. Midwifery is all about relationships, and I put up these pictures here because it's a journey. It's a huge transition in any couple's lives, and we cover that journey. That's our job as midwives, to be with women, their partners, their families through that life phase. And it's a huge transition, and there's a lot of ups and downs during pregnancy and childbirth. So we have a huge role. For that, midwives, as part of that, need to develop real core specific skills. Key to that is providing evidence-based knowledge. It has to be shared learning with midwifery as with nursing, but with midwifery, it's all about choice. It's about evidence-based informed consent. So that's really important because a midwife must advocate for women. So that's a really strong, one of our core values in midwifery and UCD with their partners, bearing in mind the fast, complex situation that is maternity care now within this country and internationally. It is extremely demanding to be a midwife at the moment. Burnout is an issue. We all know that there's staffing issues. And we have a suite of programs to meet that. So to meet the professional needs of midwives and the standards that are required to be a midwife in that fast-paced contemporary maternity care, and really important, a key focus of the team and the work that we do here in UCD and what we offer to anyone who wants to come to us is translating evidence-based practice and care to service users and their families. That's just a little bit about, what we see graduate midwifery as. We have a suite of programs, and that link is really, really important. As Anna said, do your homework. Email is not the best way to get information. Avoid emailing people. Go online. It's all there for you. It's really, really important. And then the other thing I'd say is look up our profiles. Look up the midwifery team's profiles, because we have links to ourselves, and on our links you will find, so say for example, we've a YouTube all ready to go on advanced practice. Watching videos, you learn a lot more. And I know there is a couple of YouTube videos available, and through Instagram you learn about our programs. So say for example, the higher diploma in midwifery, which is a level 8. So anyone that's here that's thinking of becoming a midwife, that is a 18-month program that's available. And I'll talk a little bit about that in a second. So the other thing that we offer is advanced practice in midwifery. That's a level 9. It's a master's in science. And then we offer a suite. Now, some of these we developed ourselves, and some we were asked to develop by directors of midwifery. They are standalone 10 credits that can be taken. They can be like a jigsaw. You can make up your own masters, and that's open learning. So you can actually take one module this year, maybe take 2 the next year, whatever suits you, your learning needs, family, life happens, and build up your masters or whatever you wish to do. That's your choice. So the first one then is the higher diploma in midwifery. This is an 18-month program. It's open to all registered nurses. It's full-time. And when I say it's full-time, what I mean by that is you are 26 weeks academic modules in UCD as part of that 18-month program, and the rest of it is a practice placement in employment by the National Maternity Hospital. So as with all programs like that, there is a salary. So you're a working student, but have your protected academic time. And it's one of the offerings that we offer. And I just included it as part of graduate, okay? Because there can be confusion, is it undergraduate or graduate? So I suppose really the one I want to talk to you about is the Masters in Advanced Practice Midwifery. This is the program that I'm currently the program director for. It is a 2-year program. You can take it in a year, but in the main, it's a 2-year program. It's 110 credits, level 9 Masters in Science. This program, the current program, the curriculum was developed for in 2021. It's shared between, so we run the program, but the same curriculum is available in Trinity College, Galway, Limerick. What's different about our program is we followed nursing, and the program director of Advanced Practice Nursing, Associate Professor Mary Ryder, we went with a capability framework, and we're the only ones. That's what's different about us in UCD. There's quite a bit different. We think we're very different. We're very special in terms of midwifery, but we offer our practice placement or advanced practice assessment at capability level, not competency level, same as nursing. and that I know of, it's the only midwifery program in the country that does it at the moment. So what's good about that? Because we see advanced practitioners, these are competent midwives, and we offer a program for them to reach their ad astra, reach the stars, their capability. So what's the philosophy? For advanced practice, it's to equip midwives with the knowledge and skills so they can practice to their fullest capability. And we see that for any student, whether they're undergraduate or graduate in midwifery and UCD, it's for you to reach your potential. And we provide the supports that we have available to us, which are a lot in terms of the team, for you to reach your capability. So watch the advanced practice YouTube videos, what I would say is the best. Like, I could talk forever about the program, but I think if you watch that, make time to do your research, as Anna said, look at what we have on our website. It's really, really important, to do your reading and then see. Also, if you are thinking, apply early. There is a huge demand for advanced practice in nursing. It is full every year, and midwives, as I said, we came in 2006. We're a little bit behind on the block. So I've often found that there is no places left for shared modules. This program, you do modules in advanced health assessment, research, advanced decision making, and it tends to fill up very, very quickly from nursing. So if you're thinking of that, apply early. One of the options, so there's a couple of shared options that you can take for advanced practice. And because we have 10 minutes, I'm not going to go into every module, but there is 3 kind of core modules that you can take as standalone professional certificates, or you can build your own advanced practice program. So advanced practitioners, you can be in what's known as the support care pathway, midwifery-led advanced practice, or you may decide to go for complex high-risk midwifery. But if you're looking at, say, normal midwifery, I know you might think all midwifery is normal, but it's not. Midwives work across a range of domains, whether it's triage and in like the equivalent of an A&E of a hospital, or they could be providing leading out on innovation in labour wards, delivery wards, or maybe providing specific key care for women in postnatal units, the development of postnatal hubs. So this program here is really, really important for anyone who wants to practice and support and care for women who are breastfeeding during that whole process of lactation. It's a 10 credit module, level 9, as I say, can be taken on its own or as part of the advanced practice in midwifery. And the great thing about this program, it provides you with the expertise and the recognition and the qualification to register with the International Board Certificate Lactation Consultants, which is really, really important. And of course, it's NMBI approved. That, if you want to take a picture, get to the link. This is provided by the fantastic program director for this program, which is Denise McGuinness, my colleague, who's an absolute international expertise in breastfeeding and lactation. Maternal critical care, we were actually asked as a team to develop this back, I'd say 2015, because of the change in maternity services. As we all know, that there is an increased intervention. The actual, I suppose, service users, unfortunately, there's a higher risk. The threshold for normality has dropped. A lot more women, unfortunately, are now classified as high risk. We have a lot of underlying conditions. Women are that bit on the older scale, shall I say, the later scale of life, and that brings with it complications. We have a lot more obesity, we have a lot more diabetes. And for that reason, unfortunately, there was a need, a clinical need, and we responded to that need and developed this program, Maternal Critical Care. And this is a fantastic, highly subscribed program. It subscribed so many numbers, we actually took it off for a while, and it's back on for September. And the reason for that is because we had actually nearly everybody wanted to do it, so high demand. And this is led up by my colleague Margaret Folan. And again, this is a level 9 professional certificate, a mixture of clinical skills, online teaching, multidisciplinary, and the content provides a strong theoretical and practical grounding, okay, which gives you the capability to work confidently in that area of maternal critical care, high risk. So that's another program that's available to you. And then the third one is professional certificate examination of the newborn. And this actually provides midwives with the competency and skills and capability to undertake an examination of the newborn. So again, this runs for 1 year. It's from September to May, part-time. There will be an intake again in September. Again, we had so much demand for these programs, and then we paused them, and we're running all of them again in September. So this is clinical practicum, where you undertake supervised clinical assessments of the newborn. So midwives breaking into the scope of what it would in the past have been with obstetricians and pediatricians. So it's a new area that midwives start to develop. We ran this program since 2015. All the information is there, and my lovely colleague Liz Green is the program director for this. So as you can see, that's 3 modules you could take as part of your 110 credits if you wanted to for advanced practice, or if you want to take 2 of them 1 year, 1 of them 1 year. It's just an idea of what we do here in UCD. So I'm going to say thank you, and I'm going to leave you with my email, because do contact me. Although I've said email is not the best, because it isn't. That's my email if you want me to direct you, or I'm very happy to set up a Zoom or do a phone call. But I don't do loads of information by email, but very happy to talk to anyone who's any interest in midwifery. And there is a chat box if you have any questions. So please do. Thank you very much, Anne. And I'm going to stop sharing now.
Thank you, Dr. O'Brien, for an absolutely excellent overview of what's on offer in terms of midwifery here at the UCD School of Nursing, Midwifery and Health Systems. And I would concur, our UCD midwifery team are just so innovative, so dynamic, and we have some world-class leaders there on that team. And it's really fantastic overview that you provided for us, Dr. O'Brien. Just 2 take-home points that I would like to re-emphasize. Doing the homework, really, really important. Access those videos. The team put a lot of time and effort into those videos. They're really informative, really easy to access, etc., etc. So they're there for you. So please use them. And also to apply early. I think that's the second take-home message there, to avoid disappointment, as they say, because some of these programs is great demand for them. So please start applying, apply early, just start the process as soon as possible, and then we can always support you if you run into any difficulties later on. But thank you, Dr. O'Brien, for an excellent overview of the midwifery programs. So I'll now hand you over to Dr. Bryn Gilmore, and Bryn is going to give us an overview on the health systems programs. So thank you, Bryn.
I hope you can see my slides okay there, Anne.
Yeah, we can see them clearly, Bryn. Thank you.
Perfect. Great. Hi, everyone. As Dr. Anne Donahue said, my name is Bryn Gilmore. I am the subject head for health systems in the School of Nursing, Midwifery and Health Systems. Today, I am presenting on behalf of myself, but also the program director for the 2 program directors for these programs, Professor Martin McNamara and Dr. Jean-Paul Teeling. Unfortunately, they're both in full-day training related to these programs, so they're not able to attend, but I have their email addresses at the end, and they're very happy for any conversations. So this, I think, is the most important slide. Emily, who's on the call here, really helped Jean-Paul and Martin put this together. So this is our Leadership, Innovation, and Management Pathway program. So we call it the LIM, you might hear me refer it to, but we've really built up this pathway of the LIM modules. And as you can see on the left-hand side, there's different levels of credits. So we have 10 credits, or 30 to 40, 60 and 90, and each one is associated with a different either professional certificate, which is the 10 credit, graduate certificate, graduate diploma, and then a master's. So you actually have 4 levels of degrees that you can be awarded within this LIM pathway program. And the great thing, and it's similar to what Denise was saying with the midwifery, is they build upon each other. So if you have already done a graduate certificate, you don't have to do then another 60 full credits to get the graduate diploma. You add on and do the additional 20 or 30 credits to then also get the graduate diploma. So it's really kind of building upon itself for the most part. Some of them don't naturally fit, but most of them have these very clear pathways to go from a professional certificate to a graduate certificate, graduate diploma, and then a master's and MSc. So it's a Master's of Science in Leadership, Innovation, and Management. So these are just a couple of the examples. So for instance, the professional certificate is 1 module over 2 terms. So it takes about 6 months to complete. The graduate certificates, not the professional certificates, sorry, are 3 modules over 1 year. But again, if you had already done the professional certificate, then you've completed one of those 3 modules already. So you only have 2 modules left to do. The graduate diploma, leading and innovating in health systems, is 6 modules over 2 years. But if you already have a graduate certificate, it was then only 3 modules left that you had to complete, and so on. So overall in the LIM program, we take a systems thinking design approach. So a lot of understanding complexity, understanding how components of the health system, the social system, the economic system fit and work together, and a real design-centered approach. So thinking about not just what problems are, but problem solving and innovative user design. And we do this to develop leadership, strategy, innovation, management, and quality and process improvement. So really focus on developing leadership, developing management, and improving quality and processes at the health system. I hope you can hear this. This is a video Anne and Denise are talking about. This one's only a minute, so I just quickly embedded it into this is about the masters, so the 90 credit one. If we just listen for 1 minute.
We've no audio on that, Bryn, sorry.
Oh, it's not working. That's okay. You can see the videos online. It's very easy. Thanks, Emily, for letting me know. So you're not missing anything by me not being able to play the video, but it's just a 1 minute clip that really highlights and talks about the important aspects of the Masters in LAM. It's a part-time over 3-year program. We take a blended learning approach. So the modules are mostly online. A lot of people are working, you're either doing clinical practice, you're already in leadership positions within a healthcare setting. So there are a lot of online components to the LAM. Attendance is mostly mandatory, however, because of the participatory, really design thinking nature of how we run the modules, but we give you the schedules really far in advance so that you can make sure that you're available for those. There's a lot of continuous assessment and feed forward aspects. So you're often working on very practical assignments that relate to your own work that are working to solve these complex health problems. So we do that kind of continuously throughout the modules, thinking about real world application. So these are just some of the titles for the LAM pathway modules. And as I showed you in the first diagram of the pathway, depending on which kind of diploma, degree, certificate, master's you're going for, you'll only be taking 1, 2, or 3 of these. If you're doing the master's, you're taking the majority of these modules, but we have a really broad, holistic approach. So we think about improving health systems. There's one on health systems and health policy, collective leadership and effective teamwork. I am coordinator for one on global health. So looking at health and global health leadership broadly, not just within the Irish context. We have strategy and innovation in health systems, and then you can do the evidence synthesis or translation pathway, process improvement, and implementing process improvement. So a wide variety of modules that are all kind of really aiming to create leaders, to develop and to enhance already existing leaders within the healthcare setting. So most of our students are already in a healthcare setting, either as a clinician, nurse, midwife, or in a role in a healthcare setting. So not necessarily delivering healthcare, but already in a leadership position as well. So this is this year's timetable for the LIM pathway, which again, we give really early so that you're able to plan your work accordingly. But just so if you're interested in this, you get an idea of what it looks like. So in the first trimester, you will take 2 modules. These we run on the same day, so we coordinate and we run, there's 8 online classes throughout September to December. So there'll be 8 days when you'll be doing the modules from September to December. So you have my module normally in the morning and then health policy and health systems in the afternoon. Trimester 2, you have 1 module. And then the following year, it's the same. You'll have 2 modules all on one day, and then a 3rd module in the afternoon in the second semester. And then year 3, you have the choice of taking 2 modules, so managing process improvement and implementing process improvement. So if you're really focused on the process improvement aspect, or if you are more interested in the evidence and research side, you can do the dissertation. And that's your choice between those 2 modules on process improvement or the dissertation pathway. So just again, showing that there's a lot of scope for you to kind of build your own adventure, as Denise had in hers as well. Taking the modules, taking the pathway that is best for your career objectives. So we've had a lot of success at international and Irish events. A lot are on Lean and Six Sigma models. We run symposiums, a lot of opportunities for graduate students to get involved, present and share their work, and participate. So thank you very much. If you do have any more specific questions, Professor Martin McNamara is an excellent resource as the program director, and he is very happy to discuss the program. Think about your suitability towards the program, your pathway towards the program, or if you have any questions about the program. So thank you.
Thank you, Dr. Gilmore, again for a wonderful presentation there. And I've just made some notes here. Just some take-home messages for us all, really. I think the LIM infographic, the pathway, is just so important. And I think the emphasis on building your own pathway is just so important. I love the phrase, Dr. Gilmore, build your own education and adventure. I think that's a really great take-home message for us all today. I think that's really wonderful. And that focus on system thinking and problem solving, that's really what's required in contemporary healthcare practice, a really important area of practice. So in addition to doing our homework and in addition to applying early, I think your emphasis on the blended approach is really important as well. The importance of attendance, absolutely, but that attendance can be face-to-face or it can be online. And I think that's an important thing for us to realize for students who are interested in this particular aspect of the third graduate. So thank you very much, Dr. Gilmore, to both yourself and the wider team, a very successful team, wonderful, innovative work going on in the LIM space, as we say. And thank you, Dr. Gilmore, for being with us today. Really appreciate it. And now I'm going to move on to the MSc in Advanced Practice Nursing, and I'm delighted to introduce Associate Professor Mary Ryder, who's going to bring us through this presentation.
Thanks very much, Anne. I will just set my slides up, share them here with you. Yep.
We can see that, Mary. Yes.
Perfect. Okay. Thanks very much. So this is just purely the MSc in Advanced Practice, and I think it was mentioned earlier, it's probably one of the busiest programs in our school. We usually have about 75 students across the 2 years every year. So I know Denise mentioned it earlier, get in early. It would be the best advice. So just to give you an idea, it is structured as a 2-year master's program. However, we do offer quite a significant proportion of RPL, which is recognition of prior learning. So anybody coming to us, so you can do master's over 1 year. And then we also have a graduate certificate, which is an exit award of 40 credits. And that would be students who would come with us with a master's degree already and having prescribing completed already. So they would have to do just the decision making and the clinical practical modules, and I'll go to them. So it's the number of credits that will determine your award. And both the masters, be it the 1 year or the 2 year masters, and the graduate certificate are both accredited for and eligible for NMBI Pathway 1 registration as a registered advanced nurse practitioner. And what this means is that as soon as your transcripts are available, which is as soon as your results are available, you can download your own transcripts and you can register as an AMP with NMBI within, usually it's within 48 hours. And that is what Pathway 1 is. So as you know, the whole structure of the curriculum is there's 2 key documents, and anyone who's interested, I strongly suggest you read both. So we have our Advanced Practice Nursing Standards and Requirements, which are 2017 documents, and then we have our 2019 Policy on Advanced Pathway. The 2017 standards are currently under review, and UCD are leading the review actually of these, which is a really important project going forward. And as you can see, I know Denise mentioned it earlier, advanced nurse practitioners are required to practice at a higher level of capability. I myself am a former graduate. I won't tell you when I graduated, very, very long time ago. So it is quite important. It's a really valuable asset, and we have a number of nurse practitioners. We have 4 of us actually working on the curriculum. So it's a really a great asset for the students. So it's really important to, first of all, go through what it is an ANP should do. There's quite a lot of people who think
Mary,
they practice.
I'm really sorry, your slides aren't moving. You're still on their title slide.
Oh, right.
Just pop it into presentations mode.
Yeah, it is on. It's just not
not
moving forward.
Oh,
hang on. I might just stop and reshare. Maybe
reshare. Yeah.
Yeah. So hold on now. Let me see. We'll start just resharing.
It looks like such nice slides. We want to see them.
You just see them, yeah.
I'm sure you do.
And just while Associate Professor Dr. Mary Ryder is getting organized there, just the slides, just this particular program, it's incredibly popular, and that's down to the caliber of the program itself, the caliber of the program director, the caliber of the program team. So I think the adage apply early to avoid disappointment really applies in this case. So it's just important just to remember that as Dr. Ryder brings us through. That's great. Okay.
Yeah.
No.
Now let me just see if that is that moving.
No. If you click on presentation at the bottom, Mary, on the right hand side, see the
yeah, it is.
icon?
It's on
it is on that, is it?
in
Not
my
going.
one, yeah.
Okay.
Yeah.
All right.
I'm not sure why.
Okay.
What I can do is I'll come out of each one. Might be the best, and I can let me see. Just so can you see that?
Yes.
Okay, it might be easier if I just do it this way without going into presentation mode, would it?
Okay, that's fine. Yeah, once it works.
If I enlarge it like that for you.
Yeah,
sorry, I don't
perfect.
know why it's not. Okay. So one of the important things, as I was saying, it's really important to understand what it is an advanced nurse practitioner should do. So it's the autonomous and independent practitioner to manage an agreed caseload of patients within a specialist area of practice. And this involves diagnostics, differential diagnostics, ordering and interpreting investigations, and prescribing and managing a caseload of patients independently. They're generally low-risk patient caseloads because these group of patients don't require regular consultant input. So that's where the ANP can manage them independently. A complete episode of care, and we go through a lot of explaining to you what's the difference between episodes of care, because that's what's defined in the Department of Health policy documents. So they will also make and receive referrals within agreed parameters for their caseloads of patients. They usually have about 3 caseloads. And one caseload can often be a collaborative caseload on a complex group of patients. They are primarily the leaders for implementing changes to healthcare delivery with a focus on improving access to healthcare. And it's an important function of the role to record and report the outcomes of the service. And they're also recognized as leaders in nursing research. So Denise mentioned it earlier, ANPs are required to practice at a higher level of capability, and we are the only program in the country that offer the capability framework. We're actually the only program in the country that have an evaluation of our program. So, and it's published in 2023. So what is it? Is a capable practitioner? It's somebody who's creative, have a high degree of self-efficacy, know how to learn and self-direct their own learning, take appropriate and effective action to formulate and problem solve. And that would be where they are very much transformational leaders in improving access to healthcare delivery, and can apply competencies in familiar and unfamiliar situations and work well with others, which is really important part of teamwork. So as I said, we're a very active group, both in relation to evaluating the curriculum, but also in leading on research in advanced practice nationally and internationally. Just to give you an idea of the course structure, as I said, you have an option to do it over 1 year or 2 years, a master's or a graduate diploma. Your actual modules that you complete are determined by me, which is a responsibility that's handed over from the regulator from NMBI. So when you apply, Nicola, who's also on this call, is my really important administrator, who plays a huge role in the application process. And the modules are all from advanced health assessment, leadership, and it's not just leadership in nursing, it's leadership, quality improvement, and governance. Advanced practice clinical practicum, which is a year-long module, and we have a dissertation module where you have a choice of doing evidence synthesis or evidence translation. Prescribing, then there's a suite of prescribing, and sometimes nurses moving from the UK might just have to do the context of prescribing module. If you're a registered prescriber in the UK, NMBI will tell you that there's one module you can do. So we have a standalone context of prescribing module you can do there. And then we have advanced research methods, and as I said, our decision-making course. One of the important things in this is clinical supervision. This clinical supervision is required for prescribing, for both referral for radiological procedures, also for medicinal prescribing modules, where you're required to complete 100 hours of clinical supervision. You also have to work very closely with the clinical supervisor in relation to advanced health assessment, and particularly with your advanced skills in my own background is cardiology. So you have your advanced skills in cardiology, in cardiac assessment, say, for example, listening to murmurs and S3s, but that's just from a cardiology. Then in our advanced practice clinical practicum, there's two components to this. So we have the minimum requirements, which is 500 supervised hours as directed by NMBI. And then it also includes your professional portfolio submission. So it's a really intensive module. It's quite a very busy module. So again, we would be the only university that have two different mentorship structures, not just supervision. It's both mentorship. We have a clinical mentor and a professional mentor, because as part of your portfolio, it's important that you have a lot of professional leadership activities. So your professional mentor is either a registered advanced nurse practitioner or assistant director of nursing. They don't need to be working in the same area of practice, whereas your clinical mentor must be a consultant in the area or a registered advanced nurse practitioner within your specialist area of practice. And then within this module as well, I'm a registered AMP, but I also have a team of 7 registered AMPs who provide peer mentorship to the students to help you to navigate the whole clinical background. And we're the only university in the country as well that offer this structure. So we always have 50 students in this group, but we divide everybody into much smaller groups where you will have monthly meetings with your peer mentor to help you navigate through the module requirements, the portfolio requirements, and in negotiating the difficult clinical environment with multiple different parties. So the application process is quite extensive for this. I will just to tell you, Nicola is, as I mentioned, keeps a great hand on everybody and the volume of documents that are required with your submission. So what I would say to you first is you need to get all of your transcripts from any of your postgraduate qualifications. We need a copy of your registration certificate. And I did mention we have advanced health assessment. So if you've done prescribing, say, for example, in the RCSI with a level 8 prescribing health assessment module, you will be required to complete advanced health assessment at level 9. So it's just to bear in mind some of those requirements are in relation to advanced practice. There is then, because it includes medicinal prescribing and referral for radiological procedures, there are a number of site declaration forms. If you have those completed previously, you will get RPL and you don't need to upload them. And then we have a number of agreement forms. We have a clinical mentor agreement form, a director of nursing support. The reason we require a director of nursing support is because you will be working outside of your job description, which is in your indemnity during the program, but you work on that under supervision. So it is important that you have a signed agreement from your director of nursing to support the fact that you're working outside of your current indemnity while you're a student on the program. And as I said, your professional mentor form as well. And Nicola and I review our applications every Friday. So between the two of it, Nicola usually will contact you if there's forms outstanding or if there's something that's incorrect. We also have quite a detailed instructional video on our website, which again takes you through the application process, because as I said, that's quite an extensive process because it is a registration program. We have one of the largest teams of ANPs in the education sector in Ireland running, who are all contributing to this program. And it's very highly evaluated by our external examiner, who is former chairperson of the International Council of Nurses Nurse Practitioner Group. And so we have really, she is our external examiner at the moment, and it's very positively evaluated as well by our students. And I just want to say thank you to Nicola, who's there, for the amount of work. And usually when you apply, it's Nicola who does the heavy lifting from that end and keeps me on track. And getting early, we're always full. Our closing date is the end of June, but I guarantee you we generally close at the end of May because we would be full.
Thank you, Dr. Ryder. That's just an excellent overview of the ANP process. Quite an in-depth overview, and we really, really appreciate that information that you shared with us today. The ANP team here at UCD School of Nursing, Midwifery and Health Systems, as Dr. Ryder has said, are the national leaders, but also international leaders. So it's a real opportunity to study with the best here at the UCD School of Nursing, Midwifery and Health Systems. And just a few take-home points there. The application process, as Dr. Ryder has said, is managed by Nicola in association with Dr. Ryder, and it is an in-depth, complex process, but there is a lot of support there. And I'd like to, as Mary has said, to commend Nicola for all her work in relation to that. It's really a team effort, and thank you for that. Absolutely apply early to avoid disappointment. That really, really is the main take-home message for advanced nursing practice. Really, there's huge demand, and that's purely down to the caliber of the program and of the UCD team who run it. And the fact that there's a video on the website to help you with the application process, that's really, really important, and please access that. So you can see our take-home messages are fairly similar. Do your homework, apply early. And again, ANP has that blended approach as well, both the face-to-face and the online as well. So as I say, Dr. Ryder, thank you for that excellent overview. Very interesting, very inspiring, and thank you for your presentation. Thank you, Mary. Now we're moving on time. Everyone's keeping very much to time, so this is wonderful. So we're moving on to our next presentation, which is a pre-recorded presentation. Now, this presentation is the MSc by Research, followed by another presentation on the PhD programs. Both of these presentations are delivered by Professor Karina Nocton, who unfortunately cannot be with us today, but she has pre-recorded these sessions before. Now, just to say that during the recording, you may hear Professor Nocton referring to another colleague and an earlier speaker, because this was recorded at a different presentation. So just you can discard that. But I'll hand you over now to Emily, who will facilitate the playing of this recording. So thank you very much, Emily.
Thanks, Anne. So I'm just going to share now, and I hope now we have no gremlins with this audio, but please do interrupt me if you don't hear the sound. Let's have a look here.
Technology can be our friend or foe, depending.
I know, I know. So I'm just going to press play, and do let me know if you can hear the sound okay.
Okay, thank you, Emily. Appreciate that.
Can you hear that?
Not hearing anything there, Emily, at the moment.
All right, let me try one more time. If not, it's not the end of the world. We can circulate it after the fact.
If you would like some time, perhaps, Emily, we could move to Sean's presentation. And then
I think
come
so,
back.
Anne.
Would that be
Yeah,
okay? Sean, would that be all right with you?
No, that's no problem at all. Yeah,
Okay.
absolutely.
So I'll introduce our next speaker. We're delighted to have Mr. Sean Kenny with us, who's our Programme Office Manager. And Sean is going to bring us down through the application process. And this is really probably one of the more important elements for our audience today. All of our speakers today emphasize the importance of applying early to avoid any sort of disappointment. And sometimes students can report that they feel a little bit inundated by the application process. Actually, the main thing is just to start. And if you have any difficulties or any concerns, well, then our excellent professional admin team will help you with that, okay? But I would advise you, if you're interested in any program here in the UCD School of Nursing, Midwifery and Health Systems, is to apply now. Start the application process, because there are various things that you will require. You require references, transcripts, etc., etc., etc. So the earlier you start, the better. So as I say, Sean is going to bring us down through that process now. So I'll hand you over to Sean. So thank you very much, Sean.
Brilliant. Thank you so much, Anne. You're very kind. Absolutely, definitely, I agree with Anne. It's definitely, it is very important just to apply as early as possible. As I say, you might run into a few things that might prevent you with the application process. But again, that's what we're here for. We're here to help. The good news is that UCD recently made a fairly significant investment in our application system, and the aim is really twofold. It's really to streamline the whole process of applications, to make it a lot easier for yourself as well. And this new system, which you'll see, is it breaks the whole application system down into tasks, so you can see where you're at, what you're missing, if there's anything else that's needed. And it's easier then again for us here in the school then to review your application, assist you if you have any issues with it as well, and overall you'll get a faster decision as well. So as I said before, there's a really large suite of programs available in their UCD catalog. The first thing they've done here is it's a lot easier for you now to firstly review the suite of programs, see what's the best program for you, what are you interested in, and from there then is to actually, firstly, it'll allow you to apply directly. You don't need to go to a separate screen or a separate system or anything to apply. You can apply directly from there. And as well as that, it's highlighted here, if you have any issues at all, fill out the contact information. It's very, very straightforward. It'll ask you for your name, your email address, and just your actual question. And what that will do is that will filter through to us here in the school, and it'll go to the dedicated administrator for that program, who's very, very familiar with all of the requirements for that specific program. If it's a separate program, it may go to a separate administrator, but it will be that person that will assist you with it. So you're getting a dedicated person assisting you with the application process if you have any issues at all. So once you've done there, you start it, and here it'll also give you all of the requirements, any part of the application that you need. There are separate forms, separate requirements for each program, but it's all dedicated here on our website. But again, if you have any problems or queries on those, we're here to help with that part as well. So the first thing is then you'll be directed to just the below login page, welcome to UCD. So you'll either, if you're an existing student, you can log in. If you're not, that's absolutely fine. You can go to create an account, and what it will do is allow you to create a profile with us in the application system. So then once it's created, you'll get an email from UCD IT Services with your login details. They'll also send you a hyperlink, and you can click continue there. And then from there, it'll bring you directly to the application form for the program you've selected. And so again, it's very much streamlined. It's step 1, 2, 3, 4. So it's asking you then to complete all the required application tasks. So you can see here that it's straight away up at the very top, you have 0 to 9 required tasks completed. So it's telling you there's 9 tasks, 9 parts of the application that you have to complete. So your profile, the English language, your college. So it's telling you exactly what's needed and what the task is done. So on the next page, you'll see, okay, I can see that this part has been completed. And again, if you have any issues with those, we ourselves here in the school are able to pull up your application, review it, and see, I see you've completed 8 out of the 9 tasks. There's one part left that's missing, and that's the part that you're stuck on. That's what's needed. So it allows us very easily, and yourself very easily, very clearly able to see what's missing or what's needed to progress your application. So it's just made it a lot clearer for you, and it means you get a lot faster result from your application as well. The third thing then as well is that this is another aspect here where you're still able to ask us a question here. That's our school connector. So that will filter right down through to the school and to the direct administrator for each of the programs. So again, if you have any issues or problems with those at all, that's what we're here to do. We're here to help with it. Overall, I think it's been very successful. The investment made into the application system to make it a lot easier for everyone to apply and to get the result that they want for the program. But as I said, if there is anything, please don't hesitate to get in touch with us by phone or email or even just through the connector here. Hope that helps everyone.
Okay, Sean, thank you very much for bringing us through that process. And every time I listen to Sean informing us about the application process, I learn something new each time. So thank you very much for that, Sean. And again, the take-home message here is don't be daunted by it. And there's lots of help, there's lots of support. The application process, the interface has been revised and it's much easier to use than it was in the past. But the key message is apply early because, as I say, some of our programs are really sought after, much sought after. And, you know, you will be asked for additional references and whatever. So the earlier you start, the better. And then once we know you're in the system, we can provide additional support and guidance. So Sean, thank you very much for that. That was very informative and we really appreciate it. And sorry for bringing your presentation forward a couple of minutes, but we do appreciate you stepping into the breach like that, Sean.
No,
so
not at all.
Emily, I'm just wondering.
Well, I've had no luck, Anne.
Okay, that's so
I have been busy Googling in the background, and I know there is the share audio, but for some reason it's grayed out for me. I can't actually click it to share the audio, so it must be a setting on my computer. As always, there is something. So
well, the one guarantee with technology is that
I
it will
know,
let you down
but
in some shape, make or form, but that's fine,
stop.
Emily.
Well, look,
yeah.
what I'll do anyway, I'll share just the area on the website where you can find information about the research and the PhD programs.
Yes.
So if you are on the main school website, you'll see it here. It's ucd.ie/NMHS. That's the kind of shorthand for it. All of our programs that we've been discussing are under the courses tab here. The ones that Anne showed you earlier on are under Talk Graduate. Well, the majority, if not all, of the programs that we've been discussing in today's webinar are there. The research programs, so we have 2 research programs. Those are the Masters by Research degree, and then we also have our PhD doctorate degree. So what I might do after this session, I will share the recording with everybody of Karina's presentation, just speaking about these 2 programs. So please don't worry, you won't miss out any information. I'm sure it's quite possible most of the attendees here are actually looking at our Talk Graduate programs before we look to progress on to this kind of level 9, level 10 type of programs. But just to say, if you are interested, you can have a look at that after the fact. So I do apologize again. Definitely something we'll just have to ensure in future is not happening and the gremlins are not there. We can test as much as we like, Anne, can't we? There's always something.
Absolutely. That happens every time. There's always something, the best laid plans. But as you say, Emily, I think the vast majority of people on the webinar today are really looking at our level 9s. They're really looking at the Thought Graduate space. And I think the fact that we're able to share the recording afterwards, I think that's very, very helpful indeed, and probably indeed more helpful, because for those people who really want to look at the Masters by Research or the PhD, they can take time to actually digest that in their own time. So I think that's really, really, really helpful. So in relation to that, I think then in terms of, just to remind people that the chat function is there if anybody has any questions, and we have our professional staff there eager and willing to answer your questions. So please use the chat function if you have any questions. Now, am I right in saying, Emily, that we're bringing our session to a close now? And I just would like to thank a few people. First of all, Emily, for both organising and facilitating such a wonderful webinar. You make it look so easy and so smooth. An awful lot of work goes on behind the scenes in setting up a webinar of this type and of this quality. And Emily, thank you so much for that. There's gremlins in all our systems. I had major gremlins this morning in mine, so I fully understand that. And Emily, thank you for your work. We really, really appreciate that. I'd also like to thank each of the speakers for excellent presentations. Professor Denise O'Brien, Dr. Bryn Gilmore, Associate Professor Mary Ryder, Professor Creena Naughton, and Sean Kenny. And as I say, thank you for taking the time to be with us today, and also for those excellent presentations. I'd also like to thank our professional administrative staff who are working away behind the scenes there, Sean Kenny, Nicola Berry, and Myrta Kenzik. Again, as I said before, our professional administrative staff play a key role in our school. They're highly skilled, have a lot of information that is particularly relevant to the audience for this webinar, because you're concerned with the application process and getting into UCD. And as I say, our professional administrative staff can guide you through that process. So thank you, Sean, Nicola, and Myrta, for taking time out of what I know is a really, really busy time to be with us today. We really appreciate that. I'd also like to thank any clinical colleagues who are on the call with us. Obviously, our clinical sites, we work in partnership with them, and we couldn't deliver any of our programs without the support of our clinical sites. So thank you for that. Finally, I'd like to thank you, people who've attended today. I know how busy it is out in healthcare practice, and thank you for taking the time to be with us. We hope that you will consider the UCD School of Nursing, Midwifery and Health Systems and take the opportunity to study with us. The UCD School of Nursing, Midwifery and Health Systems is definitely a family, and we have had students who've joined us at undergraduate level, straight through into master's level, straight through into PhD, and they're now members of our faculty, and we're delighted to have them as colleagues. The take-home messages, and I know I'm repeating myself, but the take-home message is: do your homework, look at those 15 different areas and decide what it is that you are particularly interested in. Apply early. Our programs are in great demand, so please don't be disappointed when a program is full. There's a finite number of places on all of our programs. Start applying early, start that process as soon as possible. Link in with your manager, okay? Get support from the clinical site. Talk to other people who've done similar programs. Perhaps bring a buddy with you. It's nice to, when you're studying, to have somebody studying with you. So bring a buddy with you from the clinical area. And talk with your manager about fees, support, protected study time, those sorts of conversations. Have them now. I know you think September is quite a long way away, but in the academic calendar, it's just around the corner for us. So you really need to get in and get started now in March if you want to be with us in September. So that really brings it to a close. I just want to open and just see if Emily, Sean, Nicola, Bryn or Myrta have anything that they want to add. No, I'm not hearing any sounds or noises. That sounds
No, thank you very much, Anne, for organizing and sharing, and we hope to see everybody online in one of our programs in the future.
Thank you, Bryn. We do absolutely hope to see people in September. And as I say, if we can be of any help to you, please contact us if you require any further information. And as I say, Emily will share those 2 recordings that unfortunately didn't play for us today. Okay, so enjoy the rest of your day. Thank you very much, everybody. Thank you. Bye-bye.
Thanks, Anne. I'm just letting